Hi, I'm Kumail. How are you?
मैं बहुत खुशी आपका देखने के लिए।
वाह वाह, आप उर्दू बोलते हैं?
नहीं तो काफी टाइम दिल्ली में, कराची में, बूदाद में।
अच्छा, वाह वाह. I'm excited to talk to you because, my wife is immunocompromised, and so we have not had the luxury of being able to sort of take this not seriously. The other night, we live in Los Angeles, and just a couple nights ago, Emily and I went out on a walk, and we were wearing our masks and dark streets, and we went onto the main street. We saw these restaurants and bars completely packed, nobody wearing any masks, and it felt like we were in the Twilight Zone or something. Like we saw like a glimpse into another world, and they were looking at us like we were fools. So where do we stand with all that?
Well, first of all, you're not from another world in the sense of being wrong. And they are in a city that is at risk of becoming like New York and exploding in that way. We're still in the very beginning, unfortunately, of this pandemic. We're not in the middle. We're not at the end. We're not about to have yet the second wave. We're about to have the completion of the first wave.
A friend of mine just texted me the other day, and he was like, "What are you doing for July 4th?" Not getting COVID. So my question to you is, what the why? It's been so baffling to me.
There's no room for denial or alternative reality. We have 500,000 people who've died already worldwide. We have 125,000 Americans who died. Some portion of those died needlessly. We had 10,000 cases in the world 3 months ago. We have 10 million cases in the world today.
You also, I know you marched with Dr. King, and you've been a civil rights activist your whole life. We found that this virus has, in America, affected Black populations more, as well as marginalized populations all over the world. Do you want to talk about that a little bit?
Sure. In Georgia, for example, 80% of all the deaths were African Americans. African Americans are 3 or 4 times more likely to have, if they contract the disease, a bad kind of a disease where they wind up in intensive care or on a ventilator. So this virus exacerbates the already present difficulties of systemic racism, of all the other isms that we seem to have been exacerbated during this particular president's presidency.
It seems like here in America, there doesn't seem to be a organized effort nationwide to control this virus. It's sort of been up to the states and the governors on their own. Similarly, it feels like globally, there has not been a organized effort to combat this as sort of one big problem. Do you think that a organized global response is the key to stemming the harm caused by this virus?
I do. You've got a virus, it's attacking everybody all around the world. It doesn't respect borders, it jumps back and forth. Even when you're protected and have done such a great job, it comes back. You would think that coordination at a global level would be a good idea. And you might think this would be a terrible time to, for example, withdraw from the World Health Organization.
Yeah, who would do that?
Nobody would ever do that. We need the World Health Organization and Gavi, IAVI, the Global Fund, all these great philanthropies like the Gates Foundation, the Wellcome Trust, Skoll Foundation, Rockefeller. We need everybody coordinated because we will eventually get a vaccine. That needs coordination. That needs all the nations of the world to talk about what's an equitable distribution of that vaccine. How does it go to which countries? The ones who make it, the ones who need it, the ones who can buy it. So WHO has been hosting meetings like this of all the countries of the world. There's only been one absentee, us.
Why are the symptoms so varied and the severity of the symptoms so varied? It seems like most things, if somebody gets the flu, there's different levels of flu, but you know what the flu is. With this, I feel like every other week I read a new symptom.
Well, first of all, we think of it as a respiratory disease, so we immediately draw a comparison to the flu. But it is a respiratory disease only in the major way in it's transmitted is by droplets of disease. When you're talking, as I'm talking to you now, we're lucky because you've got Zoom, so I can't spit on you. You can't get my spittle when I'm talking, but I'm actually broadcasting.
Well, I trust you. I trust you and your spittle, and you can trust me and my spittle. Nobody's more terrified of this virus than me, I promise you.
But the problem is that this is not like a flu, even though it's spread like a flu. This is more like smallpox, which was also a respiratory disease, or measles, a respiratory disease. They are in common in that they're spread by respiration, but they are more like those other diseases because they affect almost every organ in the body. So there are a lot of different reasons why you might get one of the different forms or sizes. The smallpox had 5 or 6 different manifestations. It was all the same disease. But I worry a lot that people immediately compare this to the flu and thereby minimizes it and makes it into something that's less dangerous than it really is.
You mentioned vaccine. Obviously, that's the thing that we're all waiting for. There's a New York Times coronavirus vaccine tracker page that I click on every day. I would say hundreds of times every day. So I wanted to ask you 2 questions. You alluded to this earlier. One, do we have some sort of sense of when we can expect one? And then once we do have one, or hopefully more than one, how do we get it to everyone in the world?
Yeah, the second of those questions are that you have a vaccine campaign and program around the world. We need to think about long timeframes to deliver the vaccine to the corner of every country, the most remote, the most vulnerable people who tend to live the farthest away from the capital cities. And when will that be? None of us really know. It should be encouraging to note we are now doing things in the manufacture of vaccines. We're doing them in parallel instead of doing them in series or in sequence. So that will shorten the period of time that it takes. And we need to shorten it because previously the fastest vaccine we've ever had took 4 years.
So how are you feeling overall? Are you feeling generally optimistic about the next year or so of our lives? I see your eyes narrow.
I'm disappointed, I think.
Yeah.
But I certainly appeal to the best of our instincts when I say, please wear a mask, wash your hands, sing whatever song you want twice while you're washing your hands, stay 6 feet apart, practice kind behavior, and we can defeat this disease, but only if we all work together.
मुझे आपको शुक्रिया बोलना है। मैं जानता हूँ आपको आप बहुत बिजी हैं, मगर आपसे बात करने में मुझे बहुत मजा आया। So thank you.
तो आपका देखने के लिए, आपका मिलने के लिए बहुत खुशी है। तो आशा है कि जल्दी फिर मिलेंगे।
इंशाल्लाह।
इंशाल्लाह।